So we are going to demonstrate self dry needling for the brachioradialis muscle. So this is what we have got, the brachioradialis muscle, lateral epicondyle. Okay, from the lateral epicondyle, this is what you can palpate easily. This is, you will get one trigger point in the brachioradialis muscle. So first I am just demonstrating self dry needling for the brachioradialis muscle. So I am going to sterile the area. It should be always in unilateral direction, any direction. It should not be to and fro. Okay, it should be always unilateral direction, any direction, up till down, down till up, medial to lateral, lateral to medial, any direction. Okay, let it get dry. Meanwhile, we'll take one needle. So for this, we have got only one trigger point. So trigger point we need to palpate with the flat palpation. So this is what we have got, the trigger point for the brachioradialis muscle. Easily I can palpate. Okay, then needle size will be taking 25 to 30 mm depending on the bulk of the muscle. We can hit the bone over here easily, that is brachial packing. Okay, now in the lateral side we have got the radial nerve passing, in the medial side we have got the medial nerve. So what we have to do, we have to avoid going towards laterally, we have to avoid coming towards medial side. Okay, so how we will remove the needle from the packet? Okay, so we'll just remove this flap. We don't recommend to remove completely so that the needle will not fall. Twist it little bit, take it out. Now how you are going to remove the needle from the guide tube? This plastic tube is called guide tube. This blue structure is the stopper. Okay, so basically what we do, we hold the needle with the index finger and the thumb. We never take out the needle from the guide tube. What we do, we just pull it a little bit so that this will be removed. Okay, then hold this needle slightly tilted over the guide tube, wall of the guide tube, so that the needle will not fall. Now what we have to do, we have to hold the needle over the trigger point perpendicularly, because we cannot go this way, we cannot come medially. Okay, so hold this, okay, perpendicularly, press the needle nicely. The guide tube should be pressing over the skin so that you can see this mark. Okay, press this. Now the tap should be one go. Okay, we should not tap it many times. Okay, tap should be one go. So what we'll do, we'll tap and press till the time the head goes inside this guide tube. So what we'll do, we'll tap, just, it is not going to pain. Now you can see that the needle is standing perpendicular. Okay, now hold the needle from the junction and insert the needle 80%. Insert the needle 80%. So it is not a painful technique, nothing to worry. Okay, it's a painless technique. Once you have inserted that, you can do the maneuvering of the needle. How you are going to do, we have got three types of maneuvering: to and fro, twisting and twirling, and the third one is the brachial packing. So to and fro is like taking out 20% of the needle. You can see to and fro. Then so you can do 4-5 times. Okay, so that it will increase more blood circulation around that area. We are creating more and more macro trauma around that area. The second one is the twirling and twisting. So what we need to do, we need to rotate the needle in single direction. Okay, so unilateral direction, rotate the needle. I'm just rotating it in clockwise direction. Now what will happen, the fibers of the muscle fiber is getting coiled along the needle. So you can see that the tension in the needle. Okay, if I'm rotating it more, I'm feeling a linear stretch force inside the muscle. So that will again accelerate the result output. Okay, now after that we'll keep the needle for 3 to 5 minutes. Okay, after 3 to 5 minutes we can remove the needle. So what we'll do, in order to remove the needle, first we need to unlock it. In the way we have rotated in clockwise direction, so I am just rotating the needle in the anti-clockwise direction so that the muscle fiber will be uncoiled. After that what we'll do, we will remove this needle and we are going to keep this needle in the sardine container. Okay, and after that we need to do post needling stretch. So post needling stretch we can do so that it will decrease the soreness around that area. And post needling, later on we can advise the patient to apply hot pack or cold pack, whatever patient usually prefer. I usually prefer the cold pack to decrease the soreness. That is how we can do that. Again, we can recheck the hardness of the trigger point, and we can feel that the trigger point has become very soft.